Hello everyone, I am Sanjana, Onco nutritionist from ZenOnco.io. Today I shall be talking about the importance of nutrition in liver cancer. The most important type of liver cancer which we come across is the hepatocellular carcinoma. It is a common kind of a liver cancer which develops from the main liver cells which are called as the hepatocytes. Now, hepatocellular carcinoma will occur only after a person has developed liver cirrhosis. Liver cirrhosis is nothing but end stage liver disease, wherein there is scarring of the liver tissues and it cannot be regenerated. So, this condition is specifically irreversible. However, nutrition plays a very important role for liver cancer patients. What are the common signs and symptoms, and what are the physical signs which we need to keep in mind? So, first of all, the common signs and symptoms which we see in a liver cancer patients is that they experience significant weight loss, right? There is abdominal swelling, mainly because there is ascitic fluid which builds up, and there is also jaundice, which is the yellowish discoloration of the skin and the eyes as well. And they experience a lot of fatigue, and there can also be loss of appetite. As a nutritionist, it is mainly important to three main signs in the patient. First of all, we need to see if they're having edema because there is fluid retention in the body, right? So that, and next we need to see if there is yellow discoloration of the skin or even the eyes. And also it is important to note if they have been having significant weight loss. So these are some of the important signs which need to be seen in these liver cancer patients. Now, next we move on to see what are the objectives of medical nutrition therapy for liver cancer patients. First important is that we need to reduce the fluid retention and the ascites. Next, we need to correct the protein levels so that it will improve the hepatic production. Managing the side effects or the symptoms in liver cancer patients is extremely important. Now, because of the various treatments which they undergo, it could be a chemotherapy or it could be a radiation as well, due to which the common side effects or the symptoms which they might experience is nausea, vomiting, loss of appetite, and all of this can lead to malnutrition, which can alter their nutritional status. Now, because their nutritional status is altered, it can put them at a risk of developing infections, and it can also have a negative impact on their quality of the life. Also, it is very important to focus on the foods which are rich in antioxidants and anti-inflammatory foods as well. Maintaining an adequate hydration is also very important. Next, it is essential to understand what diet needs to be given for the liver cancer patients. So now sometimes what happens is that because of the underlying treatment they are undergoing, right, they might experience loss of appetite, or so their oral intake can be reduced up to 60 to 70% of the total body requirements, or they can also be experiencing difficulty in swallowing perhaps, or it could be that they're having experiencing nausea or vomiting as well. So during this time, if they're not being able to tolerate the oral intake, the next approach is tube feeding. Generally, a high protein diet is recommended for these patients along with a moderate carbohydrate intake, wherein we are going to be focusing on millet based diets rather than gluten. Because again, wheat contains a protein which is called as gluten, and it can also sometimes cause inflammation in the body. Now, in the advanced liver cancer patients, sometimes they can also experience hepatic encephalopathy. So, during this time, what happens is they have an altered sensorium. The patient can also be disoriented as well. During this time, it is extremely important to make a note of the ammonia level. Now, if the ammonia levels is high, we need to ensure that we give a low protein diet because we want to reduce the total ammonia levels in the body as well. Salt restriction is very important for a patient who is having moderate ascites and edema as well. Also keeping in mind that fluid restriction also needs to be there because already these patients are having a fluid overload as well. Tube feeding, yes, it can be recommended for these patients. However, complete parenteral nutrition needs to be avoided because it already the patient is having a fluid overload or a fluid retention. It is very important to check the liver function test, especially the protein levels and the albumin levels as well. So if you see that the albumin levels are low in the diet, then low in the blood parameters, then yes, it means that we need to improve on their protein intake. So you can also ensure to give them plant-based protein sources such as low fat paneer, or you can give them pulses and legumes or alternative sources of milk like almond milk or unsweetened soya milk, which are easily tolerable. Encourage to give them small frequent meals because as we see these patients also have a loss of appetite and they sometimes don't tend to feel hungry as well. Liver is a major organ which plays an important role not only in detoxification but it also plays an important role in fat metabolism, carbohydrate metabolism, and protein metabolism as well. Generally, medium chain triglycerides are tolerated well by the patients because it is easily digestible in the body and also it helps in the easy digestion of fats. And MCT, otherwise which is known as medium chain triglycerides, can be quickly absorbed and they provide a quick source of energy for the body as well. So, to conclude, yes, nutrition plays an important role for the liver cancer patients. It is important to identify the patients who are at a risk of malnutrition and also to give them um, early intervention. Not to forget keeping in mind the the protein intake and also to ensure that they get adequate amount of energy by incorporating calorie dense foods also. Thank you for watching my video, and we at ZenOnco.io are here to guide you throughout your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.